Welcome to Askimo TV. We're talking today to Dr. Romesh Angunawela. Dr. Angunawela is a consultant eye surgeon specializing in corneal and lens surgery and laser eye surgery at Moorfields Eye Hospital in London. Hi, Dr. Angunawela. How are you?
Good morning, Joanne. It's a pleasure to be here.
Lovely to be talking to you today. Dr. Angunawela, let's talk today about laser eye surgery. So what is laser eye surgery, and is it the same as refractive surgery?
So laser eye surgery is a technique to correct visual aberrations in people who are short or long-sighted or who have astigmatism, essentially to get rid of glasses so that they can see clearly. It's a technology that's been around for about 25 years, and it's evolved over that time into a very sophisticated type of surgery that uses a lot of technology and advances to scan the eye for any sort of visual aberrations within the eye as an optical system, a bit like you would if you were trying to test a camera for a very high-end, a lens for a very high-end camera. You'd be able to quantify the optics of that camera by measuring it in certain ways. And we can do that, and we can feed that information into a laser, which then corrects the cornea, the front window of the eye, so that you have the optimal optical properties to the front window, so you can see much, much clearer and get rid of those glasses. Refractive surgery is a generic term, which is a bit of an umbrella term that involves a lot of different techniques, one of which is laser surgery. But it also encompasses lens surgery for patients who want to get rid of their reading glasses, for instance, and who have multifocal lenses put in, or any other technique to improve vision and get rid of glasses. Refractive surgery essentially is getting rid of the need for refractive correction, the need for glasses.
What conditions can laser eye surgery treat?
Well, there are three common types of refractive error, and those are short-sightedness, myopia, long-sightedness, which is called hyperopia, and astigmatism, which is a mixture of those two. Short-sighted people find it difficult to see in the distance without glasses correction. Long-sighted people, depending on how long-sighted they are, generally find it difficult to see things at near distance, but can find it also difficult to see things in the far distance. Astigmatism is where you have more than one point of focus, and that's because of the shape of the cornea not being regular. So you can be slightly long and short-sighted if you have astigmatism. And with the laser, it's possible to scan the shape of the cornea and the refractive error that the patient has, and then apply an ideal shape to the cornea so that those errors are corrected and wiped out so that the patient can see clearly.
Tell me a little bit about what somebody can expect to happen in their laser eye surgery. Is it painful?
Sure. Well, the surgery itself takes about 10 to 15 minutes to perform. The actual laser components of the surgery happen in seconds. And there are usually two parts to the surgery. One, in LASIK, involves making a very thin flap, which is about 1/10 of a millimeter thick, using a laser called a femtosecond laser. That takes about 10 seconds to do. It takes a little bit longer just to get the position of the patient right and to program everything so it happens properly. The patient usually is lying on a bed that sits between the two lasers that we use, and we can swing the bed between the two so that we can position the patient's head underneath the laser as we require it. So once the flap is made, we swing the bed over to the other laser called an excimer laser. We then very gently lift the flap up, and we then can apply the excimer laser, which is the laser that actually corrects the patient's vision, and that will reshape the cornea into an ideal shape. The flap is then repositioned over that area, and a contact lens is placed over the eye for a day. Very little discomfort is felt by the patient because local anesthetic drops are used. Those are just applied before the surgery, and it completely numbs the eyes, so you can't really feel anything that's happening. Patients are often concerned about whether they'll be able to keep their eyes open during the surgery, and that's usually not a problem because we use a very small clip to keep the lids open. Another concern seems to be that they're going to move their eyes around while the laser is doing the vision correction. And again, these lasers are really very highly evolved, and as soon as you're positioned under the laser sort of recognizes your eye and begins to track every little movement, so that if you move very slightly, it'll reapply the laser at exactly the right point that it needs to, because it's tracked that movement. If there's a very large movement, there's a safety mechanism that cuts the laser out so that it doesn't proceed any further.
What should or shouldn't people do post-op to recover as quickly as possible from their laser eye surgery?
In the first few days after laser eye surgery, it's very important not to rub the eyes or touch them. Be very gentle, because the little flaps that are made, as I said, they're about 1/10 of a millimeter thick. They're very, very fragile. You can wrinkle them. It's pretty unusual to find patients having wrinkled their flaps because they generally follow instructions, but occasionally you can do. And we tend to give our patients goggles to wear at night for the first week or so, so that they can't rub their eyes while they're sleeping. Other things to make note of are really not to wear any makeup if you're a lady, particularly mascara around the eye, because that can start floating around the tear film and get in under the flap again. We do discourage going swimming or splashing tap water into the eye within the first week, but usually after a week you're okay to go back to completely normal activities, including swimming and other sort of physical activities.
Just to finish off, who would not be a suitable candidate for laser eye surgery? Is there a minimum age?
There is a minimum age, Joanne. The cutoff in the UK is 18 years old, but really we'd probably cut off at around about 21 years. What we want to see really is that the glasses prescription has been stable for at least a couple of years. Otherwise, you're chasing a moving target with your laser correction, and the patient might find that they're short-sighted again if their prescription is really going to be changing just as a consequence of aging. So probably really 21 is the cutoff, with evidence that their glasses haven't changed in the last few years. Other patients who aren't suitable for laser eye surgery are patients with very high refractive errors, and those are patients with short-sightedness past around about -10, and patients who are long-sighted more than +5. And the reason that we don't tend to operate on patients beyond that range is that we have a safety cutoff that we like to keep the structure of the cornea intact, so it doesn't become weakened by the laser. There are very good alternatives for these patients. There's a type of technology called the Visian ICL, which we can use in short-sighted patients in particular, up to -25. So there are many alternatives to laser eye surgery these days that give excellent results, if not as good as laser surgery.
Thank you so much for talking to me today.
It's been a pleasure, Joanne.